Good morning, good evening, everyone. So today we want to talk about psychiatry, and we have Dr. Vipan Kumar with us, who is on our panel, and he also runs successful telerotations for us. And he's going to talk about why psychiatry is becoming harder for IMGs, and how can they make a competitive profile, and what all they need to do to have a successful match in psychiatry. So welcome, Dr. Kumar. Glad to have
Thank you.
So let's start with your introductions. Talk a bit about your residency and now where you are and how are you helping the IMGs.
Well, like many IMGs, I'm also an IMG. I went to Windsor University School of Medicine in St. Kitts. And then afterwards, I got into psychiatry, general psychiatry training at Morehouse School of Medicine. And I was there for 4 years. I graduated 3 years ago, and I've been working with the VA. And I just started working with the state hospital, forensic psychiatry. And I think the reason why I got involved with IMGs and teaching IMGs again is because I was also an IMG, and I understand how important it is to get a good education in your rotations, get a good experience in your rotations, so you can make a good decision about what you want to do after medical school, and not just base it off of just your interests, but also your experiences that you have in during rotations. And for me, my psychiatry rotations were also really enriching, really helped me narrow down that I really want to do psychiatry, even though I started medical school wanting to do psychiatry, but the rotations furthered my interest and made my decision even easier.
Okay. And of course, you are also an adjunct faculty at Morehouse, and you are intimately involved in the residency processes. So you know what it takes for an IMG nowadays to get in, or why they are filtered out. So that perspective will also be very useful to our audience. So let's start off. Tell us a bit about day in your life as a psychiatrist. Many of us are always curious to know, what do the psychiatrists do in the US after residency? What is your day in the life?
After residency, a psychiatrist can work in so many different fields. Well, just let me tell you a little bit about during psychiatry residency. You have to go through all your, rotations, all your work sites. You learn a little bit about everything. But after residency, you can pick pretty much wherever you want to work. But my usual day is, 4 days a week, I work with the state hospital at the forensics inpatient unit, where I follow about 40 patients, who have some kind of involvement with the legal system, some kind of crime they committed, and then they get arrested. And when the judge sees them, he also notices that they have a psychiatric illness, and the patient cannot understand the proceedings of the court. So that's when they send the patient to us at the state hospital, where we treat them.
I see.
And over time, when they get better, hopefully they're competent enough to stand trial. If they're not, they can be diagnosed with, the outcome could be NGRI, not guilty due to reason of insanity, or the charges may be dropped depending on the level of the charges. A murder charge will not be dropped, but if it's like petty theft, that can be dropped. So that's pretty much most of my work at this time, and part-time with the VA, pretty much Fridays, and some other days if they need me, I can help out, seeing the veterans. And that's where I see mostly post-traumatic stress disorder, substance use disorders, depression, anxiety. So that's pretty much my work week. And now I'm also teaching medical students and building that into my weekly schedule.
Mm-hmm. Okay. So now let's switch gears and talk about a couple of things. What programs look for in IMG psychiatry applicants, and maybe related to this, how the trend has shifted in the sense that psychiatry is now becoming, or at least there is a perception that it is becoming much more competitive and harder. So maybe these two questions go hand in hand. So what do a program director, program committees, what do they look for in the IMG?
Good question. That's the question that a lot of IMGs ask. Why is it so competitive now? To answer that question, I think if we look back at the history of psychiatry, you look back in the 1930s, 40s, or any other time before 1950s or 60s, once a patient has a diagnosis that is severely mentally ill, for example, like schizophrenia, schizoaffective disorders, then usually what would happen in those times is the patient would stay institutionalized for pretty much their whole life because there were no medications. Starting in the 50s, 60s, we started developing antipsychotic medications, looking at mental illness more biologically, looking at the brain, and coming up with more and more modalities to treat mental illness. And now, looking at 2021, there's so many medications that can help a patient, so many lab works we can do, looking at imaging of the brain in certain cases. So I think it's becoming very medical, as well as psychotherapeutic approaches. We also use a very intense medical approach to treating psychiatry. So the more and more advanced the field becomes, I think, that's the reason why it's becoming more and more competitive. What I heard back in medical school, a lot of medical students say is, why would I study all this take all these medical classes and then just do psychotherapy later? So now I think the perspective is changing. I think medical students are understanding that it's not just psychotherapy. It has to do with everything with medicine. So more and more people are applying, and that leads to competition and a more, less easier to get into psychiatry.
Yeah.
Mm-hmm.
So now, from a perspective of the program director, program committee, what do they look for when they see the application? What are some of the skills, experiences, rotations? What are they looking for?
So I do interview student applicants with Morehouse Psychiatry residency program.
Mm-hmm.
I'm an adjunct professor there. I think when I look at the 50-page portfolio of the applicant, all their scores, their where they went to high school, college, all the rotations they've done, I think the most important thing would be the STEP scores.
I see.
It's a very quantifiable piece of the applicant. I think number 2 would be the letters of recommendation, and not just generic letters of recommendations, but a letter of recommendation that really outlines how well the student did in the rotation, maybe specific examples that, maybe a difficult case that the student had to deal with and successfully came up with some kind of treatment plan to help the patient that aligns with professional opinions.
Mm-hmm.
So, it just shows how much the student is interested in psychiatry. And I think the third major piece is the personal statement.
I see.
When I read personal statements, a lot of the times all I see is a generic personal statement. I want to do psychiatry because I want to help people. That is already built in when you become a doctor. We already know you help people. But why psychiatry specifically? Because once you become a psychiatrist, you're dealing with mental illness all day long. Can you handle it? What makes you different? That psychiatry as a field would be where, you would wake up and just go to work and not think about it and enjoy your day. So I think those are the kind of things that students should be outlining in their personal statement. What makes them different beyond what is given as becoming any doctor? Right. What makes you that, hey, you can become a good psychiatrist? Show that vision to the interviewer before they interview you. And then they'll be excited to interview you and learn even more, and not just the basics of, why did you pick psychiatry? They should already know why you picked psychiatry. And now let's talk further. So that, I think, makes a good interview, makes a good application, a strong application. So those 3 things.
How is the research getting more important? Have you seen research becoming more important as part of their portfolio when they, apply?
Research always helps, yes. You can add that as a fourth arm if you want. Um, that shows that they're interested in advancing um, uh, the specialty in some way. And that shows that later on they might do research. It shows that they're developing skills to conduct research. So it does help. Um, but for example, if you're applying to psychiatry, if the research is psychiatry related, that would be very beneficial. But if you're applying to psychiatry and you've done research in immunology, not bad, shows that you're research oriented, but specifically to psychiatry, it might not help your.
So that was a very good perspective on what the applicants should do and what the programs look for in psychiatry. Now let's talk about the telerotations and the kind of teaching methodologies you have and what our students can learn from your telerotations.
Yeah, so I do telepsychiatry rotation because I think I started my teaching interests during COVID era. So there were no other options. My hospital doesn't allow any visitors at this time, including medical students. So telepsychiatry I thought was a good opportunity to teach and, where students can get at least a good amount of experience in psychiatry. So with telepsychiatry, the way I schedule my week is we have treatment teams in the morning at 8:30, where we review the patient comprehensively, and then we also interview the patient. And I see about 3 patients a day,
Okay.
Overlook 40 patients. The 3 patients we do comprehensively. So the students, they come on Zoom around 8 o'clock, and I tell them about the patient, tell them a little bit of a history of the patient, what their diagnosis is, what their medications are, how they're progressing, and then at 8:30 we go through the treatment team until about 10:30, 11. After the treatment team, I also require the students to present a mental status exam to me. What is with the patient, their appearance, behavior, mood, affect, thought content, thought process, all these different categories of the mental status exam. And that helps them understand how to organize their information a little bit more when they're writing their notes or even presenting orally. Instead of being all over the place, they can go through it concisely. On Tuesdays and Thursdays from about 11:30 or 12 after a little lunch break, they always need a little break to kind of help relax their brain before a lecture. So Tuesdays and Thursdays is when I do my major lectures. One lecture could be on depression, the major diagnosis under depression, and how to differentiate between each. Because all the patients are going to say, I'm depressed. But how do you diagnose and how do you look for different diagnoses? If a patient's family member died and they're bereavement, not major depressive disorder. If they recently changed their job and that's the major issue, then it could be adjustment disorder, not major depression. So I try to organize that information, and then we go through treatment for each different diagnosis, drug classes. So that's one lecture. Then I can do a lecture on anxiety disorders, same way, psychosis. So I don't do a lecture on schizophrenia, but I do a lecture on psychosis, all of the different diagnoses under psychosis. Mania disorders and substance use disorders, and then personality disorders. So I think within about 6 to 8 classes, the students can learn 90% of major stuff in psychiatry.
Wow.
As I tell them about the lecture, so they pre-read, so they come prepared for a nice group session.
Okay, so that was all that we wanted to cover. Anything that we missed? Any other parting tips for budding psychiatrists?
I would say if a student wants to become a psychiatrist, they have to be very sure about it. Just like anybody, if they want to become any type of doctor, any kind of specialty, a surgeon, you have to be very comfortable in the OR. You have to be very comfortable with the tools. So the same way with psychiatry, you have to be very comfortable with dealing with severely mentally ill patients, be able to listen, formulate ideas about what's going on, and then be able to treat the patient and focus on the positive outcomes of the treatment. Sometimes, psychiatry can be a career where you don't get instant gratification, so you have to be ready for something that's long-term, changes that are long-term, slow. So I think that'll be beneficial. Just kind of have that in the back of your mind that it's not a career where, it's not surgery where you take something out and the patient is cured. So it's not that type of career. So just be sure that you want to do psychiatry. And if you do, take good rotations in psychiatry, start writing a good personal statement, getting strong letters of recommendations. I think that would be really, that's all we really look for. Somebody who really wants to be a psychiatrist. So that's all. I'll just have to wrap it up there and just kind of, that's all I like to say about that.
Yep. Thank you very much. Thank you for your time, Dr. Kumar. Very, very informative, and hopefully it helps the IMG applicants.
Yes, no problem at all. Reach out anytime. If you have any other questions, then we can talk.
Yep.
No problem.
Thank you.